So I just wanted to record a really quick video to explain how to perform a push-up and the common mistakes which people do when doing a push-up. So the first key mistake that I see really comes down to considering our wrist position when performing a pull-up. People tend to have the habit to either externally rotate their wrists when doing a push-up or to internally rotate their wrists too much when doing a push-up, and we call that elbow flaring, right? And that moves on to the second point, which is people often do push-ups from a T position, which means their ankles, are internally rotated often, or they're straight, but their elbows are flaring. Whereas what we actually want is an A position, with our head being the top of the A and our elbows being coming down at an angle, as opposed to flaring out like a T. We want to make this nice pyramid or triangle or A position, which means that our shoulders are level, they're not flaring out, so they're not one line. Again, there's a slight bend. Your hands can be slightly internally rotated. It can be a different form of discomfort if your hands are too straight. So you want to consider having a slight bend in the elbows, but really think about making that A position. And then I'm going to go on the floor, and I'm going to then break down a few other cues for you. So when doing a push-up, regardless of whether you're doing a push-up from your knees or a full body push-up, the cues are the same. So you just want to make sure we've got enough space. Okay, so you just want to make sure first and foremost that you're in a nice neutral position. You don't want to have your hips protruding to the ground and putting additional pressure on your back, and you don't want to have your hips flaring upwards because it's going to place additional pressure on your shoulders. So you want to try and have a neutral pelvis. Again, as you can see, I'm squeezing my hands into the floor. I'm slightly squeezing my elbows so that I can control my elbow joint. And I'm inhaling, trying to keep a neutral pelvis. Shouldn't be breathing there, but inhale. I've just done a workout, so everything's shaky. Inhale. So what I commonly see when people are doing the push-up is their pelvis position. Often they're putting their feet inwards and it's too close, so it's too difficult for the stage that they're at. So consider having a shoulder width apart in your feet. Again, if that's too difficult, a regression can be increasing the width of your feet so that actually you have far more stability and you can utilize your upper body muscles without placing as much stress on your core to stabilize your body. The only other cues that I see most commonly, I would say, I think that really covers it. So the joints, foot position, hip position. And then I'd say just making sure you're doing the appropriate push-up for your degree of strength. So if you can't do a full body push-up, there's nothing wrong with doing a knee push-up. I do them at the end of a class or end of a session when I've reached the point of failure. So there's nothing wrong with it. You can make these harder or easier. The steeper the angle on your knees, the more intense the push-up will be. As well as conversely, just making sure that you've got enough patience. Building a push-up takes time, so just keep going with the process and then you'll feel more comfortable as you go.